Welcome to the Nourished Brain podcast, where we focus on mindfulness-based whole foods nutrition and the art of empowered eating to optimize health, mood, energy, and nutritional well-being. I'm Sarah Fajera, an integrative and functionally minded registered dietitian and owner of Mindfully Nourished Solutions. Let's get you nourished. Ashley Hurst MS RD is a registered dietitian who works with individuals with complex digestive challenges like Crohn's, colitis, acid reflux, and IBS. Many of her patients also struggle with fatigue, anxiety, and low mood, and have been down several paths trying to find answers. Ashley works with each person, closely considering all the aspects of their unique story. So Ashley, welcome. It is so great to have you here to talk about inositol, anxiety, and the relationship to panic disorder. What an important topic to have a conversation about.
Yeah, thank you, Sarah. I'm really thankful to be here.
Yeah, you're welcome. So, let's just start off a little bit with your background, Ashley, because I know you've got, a lot of passion, in the work that you do. So it would be helpful, I think, for context for others to know kind of where you've been, where you've come from, a little bit more about your unique story, and how you came to focus in where you do as a registered dietitian.
Yeah, so a lot of my interest really came from navigating my own health journey with ulcerative colitis. And, with diagnosis with an autoimmune disease, it can be really frustrating within the healthcare system. Just there's not a lot of support there yet. I don't think for this type of diagnosis, as they've kind of increased over the last 5 to 10 years quite a bit. And, the medications haven't really evolved that well. There's some support, but just not a whole lot. And it can be really frustrating, when you're kind of just rushed through the system of going to doctor's offices and then leaving, with only one or two options and, medication for the rest of your life or this, and there's not really any room for other routes of support. And so I was really, quite frustrated at first with just navigating that system and really finding that a lot of the medications that I was taking were only working up to a point. And it became really obvious to me that I really needed outside support other than just medication and or a different route altogether. So that's kind of where I got interested in it. And, when you get diagnosed, often you're told that, food has nothing to do with it. And that was a real disconnect for me, being a nutrition major and understanding that the science behind it, but then the disconnect of, having this new diagnosis and being told that food has nothing to do with it, and that medication is the only route, and to ignore the other facts or the other parts of the equation. So I had a lot of frustrations with just not feeling heard and feeling like my whole picture wasn't seen. And so that's kind of what led me down even my academic path, where I went to get my master's in functional medicine nutrition. And so I actually did my thesis on nutrition treatments for ulcerative colitis. And that's where I realized that there's so many different evidence-based options that we just really aren't using as a part of the treatment plan, that can be done, alongside medication or even sometimes exclusively. And so that's kind of what led me down the path of continuing to study the gut brain axis and all things gut. So really my goal in my private practice is to be an advocate for people that, are coming to me with really complex GI disorders, and to kind of fill in the gaps and sort through the chaos. So really each person that comes, I really try to make sure that they that I spend some time listening to the whole story, from all of it, even outside of when their particular diagnosis started, and then making sure that they leave with a plan always, and as an empowered patient rather than just kind of going through the system.
Mm. Wow. So it sounds like you knew enough about nutrition and enough about the functional medicine nutrition model that you had a sense, a conviction that there was something else there for you, and then maybe for patients, clients that you would work with down the road. I'm kind of curious, did it surprise you how much you uncovered and dug up about nutrition and UC and some of the really therapies that were available?
Absolutely. I mean,
Mm.
I think that is what got me really interested in, the gut microbiome and using probiotics, as a part of the picture. And yeah, it was totally surprising. And I felt like it was that, for me, it was the missing piece for my own health. And I feel like the missing piece in a lot of diagnoses that kind of fit in that category of autoimmune and gut disorders. And I feel like it truly is that, the missing piece of the equation.
Mhm. Mhm. And it sounds like you're working with a lot of individuals who have been, dismissed or just kind of written off, right? Like, well, this is the one
Right.
intervention, so here you go. So, I mean, what's really surprised you over the years as you've started to work with these complex kind of gut concerns or gut conditions? What's come onto your radar?
Well, I think this is something we all kind of notice that, now as we have more and more reliance on internet and more information available than we ever had, including research and, in headline grabbing material. I think, what I've seen is that it's it's good, and it's often hard because when there's so much information available, it makes people a bit confused on what route they should take. And sometimes it's not a right or wrong path, but more of a question of your unique story and how different and unique our bodies are. And so that, to me, I think it becomes so important to have a healthcare team and different people that can advocate for different parts of healthcare. So
Mhm.
that's one thing that I've really noticed. The other area that I've noticed is that, with gut disorders, oftentimes this population can be either misdiagnosed or not diagnosed until later. It may show up as, a fear of food. And I think with ulcerative colitis and Crohn's, that is just a natural course of the disease. Is
Right.
you kind of, when you are so reactive to all these types of foods and your body is kind of hypersensitive, it does kind of create this fear around food, and even sometimes kind of an anorexia related to disease.
Mm.
And so, it may be you may go down the path of anxiety or even eating disorder before realizing that there's a true gut issue going on. And one thing I've seen is that, I mean, almost every case I've seen with a gut disorder, there's some kind of also anxiety component or low mood, as a component of that, and vice versa. So those that have, a lot of anxiety, oftentimes there's a gut component to that as well. So I've seen them sort of, um, come together in that area, and they
Mm.
tend to come together as well.
Mhm. So in your practice, you're looking at both mood disorders or low mood, and then also the digestive health piece together, and you're tackling them simultaneously or, addressing one and then the other.
Right. Yeah. Yeah. So really, really trying to see what the deeper issues are. So if,
Mhm.
even in those that have anxiety, is there a chance that there could be a bigger picture gut issue or even
Mhm.
ulcerative colitis or Crohn's? So really looking at the whole picture and spending a little bit more time with people to find that out.
Okay, so talk to us a little bit about how you approach both anxiety and panic disorder. Really, okay, so in your minds, what is anxiety? What is panic disorder? And what sometimes gets missed, do you think?
Yeah, I mean, so there isn't, like a lot of mental illness, there isn't really a blood test necessarily for it.
Mm,
It's kind of up to up to interpretation in terms of
right.
how we decide when someone needs some sort of intervention, whether it's just anxiety about a test or something upcoming, or whether it's a physical thing, or whenever life starts to compound in a way that becomes too much. That I feel like it's really up to interpretation. So it's hard to pinpoint and hard to, in a lot of ways, hard to treat in that regard because we don't know.
Mm-hmm. Yeah, because partially it can be, like you said, situational, right? And then there can be, I think you and I both think that there can be underlying nutritional imbalances or microbiome imbalances that are fueling anxiety. So it always seems to me like, when you're
Yeah.
working with anxiety, you're thinking, yes, about kind of all the biochemical stuff, how is your body responding to the outside world? How's your nervous system health? But also, all right, so coping skills, right? Stress management and stress resilience, mindfulness, community, like all those other things, right? So, I
Mhm.
mean, when you're looking at anxiety specifically, I know that, you have mentioned to me that you kind of think of this invitation to be curious about anxiety. So, what does that mean to you? The invitation to be
Yeah. So
curious.
I definitely recognize always that there can be a physical component to it, but I also feel that you know our bodies are continually cluing us in to what's going on deeper.
Mm,
And I think of anxiety as the perfect example of that. It's an invitation to really be curious, as really if we're asking too much of ourselves,
mhm,
if we're saying yes when we actually mean no, so taking kind of too much on overall, that's kind of just overwhelming our nervous system.
mm,
And the other thing is exploring what uncertainties we're uncomfortable with. So sometimes it could just be the uncertainties of life that we just haven't haven't made peace with. And then the last one would be exploring and being curious about the things that we're resisting. And that's especially true for panic disorder because it's really all about resisting and trying to disconnect from that thing that we resist.
mhm. That's really so interesting because I've heard just a couple times over the past week that being able to work with ambiguity and just be with ambiguity and uncertainty is one of the really big factors, important factors in having excellent, resilient mental health. It's like being okay with not knowing.
Right,
Almost,
right.
right?
And
Yeah.
that's something we encounter all the time.
Yeah,
And
right.
our health is the perfect example of that.
Yep.
Is there's a lot of uncertainty and unknowns with our
Yeah.
health, and
Yep.
I think that that can be a challenge, and especially with autoimmune disease,
Mm,
because with autoimmune disease in general and in GI disorders, it's a giant mystery still as to
mm,
why you can have because you're why you can have so many different areas affected by one area of dysfunction. So
mhm,
even though with ulcerative colitis it affects the colon, you can also have skin manifestations and
mm.
even in your eye. So I find it really interesting, but it can certainly be uncomfortable, with all the different uncertainties that come up with it.
Mhm. Ashley, are there certain traits that you commonly see in individuals who are struggling with anxiety? Is there anything that you think is a predisposing factor for feelings of anxiety, whether it's physical or something else related that you look at?
Yeah, I definitely think there is a disposition to it and a genetic component for certain in a lot of individuals. And they've even found that people with panic disorder or high anxiety individuals or highly sensitive people can even sense a shift of carbon dioxide in the room. So just slight shifts which wouldn't affect someone with a normal disposition, but those that are highly sensitive, they're finding that that alone can trigger a panic attack. And I find that really interesting. And sometimes I wonder if this is more of an adaptive trait. The anxiety can be kind of an adaptive trait, kind of gone wrong. So people
Mm.
that are highly sensitive or highly intuitive, maybe that is a skill set, but
Mm.
maybe it's kind of overwhelmed within the body. And, even relating back to the gut microbiome, even that read something recently about how even extroversion and introversion can be related back to the disposition of the gut microbiome, which I
Yes.
think is really fascinating. So I think there is a certain disposition that kind of goes with anxiety disorders.
Yeah, because with the microbiome, like this is something I recently learned too, and it just blows my mind. It's so crazy. Is that the microbiome can influence how the amygdala is shaped. And the amygdala is really central, as I understand it, to the fear response, sensing threats. And so it now seems like there's actually some pretty decent research, like mechanisms there, that the microbiome can influence the degree to which your amygdala, that part of your brain, kind of senses threat or senses fear. And so, like, I think of social situations sometimes as being a threat, right? To somebody like with social anxiety, for instance.
Mhm.
I don't know if you see it the same way,
Wow.
but I just think that's so amazing.
Yeah, that is
Like,
really neat.
wow.
Wow.
Wow. So that like fits right in with that, right? Like the idea of introversion or extroversion, because if you are feeling like you are in emergency mode, because your amygdala is on high alert, right? Being in a social
Hmm.
situation, right? Your behavior would then be shaped by that, you know?
Wow. Wow.
Yeah. So, okay, so talk to us a little bit about kind of how you support individuals, kind of in the context of functional nutrition, functional medicine, nutrition. We're of course looking at mind-body therapies. We're often looking at mindfulness. So, do you do reframing with people? Is there anything specifically that you do in the mind-body realm? And then what kind of nutraceutical tools do you use or supplemental tools, things you found that really help with anxiety?
Yeah, I mean, don't do a ton. I mean, do some reframing with people, depending on kind of what realm we're talking. But, I feel like a lot of the deeper stuff would really be better done with a therapist.
Right. Yep.
So I certainly recommend that.
Right.
Really to anybody. You don't have to have anxiety to benefit from therapy by any means.
Mm,
Um, but one of the tools that I found kind of accidentally was something called Inositol. And I'll talk a little bit about the case study in a bit, but a couple things about it. So Inositol is actually sometimes referred to as vitamin B8. But it's actually a pseudo vitamin, kind of similar to vitamin D, which
mm,
is, vitamin D is actually a hormone.
right. Yeah.
So it's kind of this pseudo nutrient, but it's actually a type of sugar that is made from carbohydrate. And we tend to get it in the diet from things like beans, fruit, grains, and nuts. And it's found to be high in breast milk, but fairly low, like about a gram in that we actually get in the diet.
Mm,
So, inositol is one of the tools that I found that is helpful for mainly for panic disorder, but I've also used it for things like blood sugar regulation issues or PCOS as well. Um, so, some of the roles that inositol does within the body that we know of is that it is involved in the blood sugar regulation piece because it actually allows the cells to be more sensitive to insulin. So receiving insulin and allowing for the blood sugar regulation. And on a hormonal level, it helps a lot with just restoring, normal ovulation and normal hormonal activity.
It's interesting too with the blood sugar piece because that in and of itself, I feel like can impact mood, right? If blood sugar
Right.
swings are happening. Yeah. Yeah, yeah, yeah.
Yeah.
So what about the mental health connection? How is inositol connected to, brain health or mood otherwise? Like there's a
So
neurotransmitter connection, is that right?
yeah, so one of the areas that it does support with mood balance that we think that this is kind of where it comes in is that it supports the communication between brain cells and neurotransmitters. So it supports that communication link and seems to have a an effect similar to an SSRI, which
Mm.
is antidepressant drugs. So to some extent, it's helped support kind of the predisposition of low mood and high anxiety type pictures.
Mhm. Mhm. Okay, so, one of the big questions with any kind of nutrient, including vitamin D too, is all right, so if you know you get some from your diet, how do you know if and when you should supplement? So, what do you think about specific to inositol when you're trying to decide whether somebody's okay or whether they might benefit from additional in supplement form?
So, I think with anxiety and stress, I tend to look at their level of stress and even carbohydrate digestion because we know that with high stress your body kind of goes from rest and digest mode to fight or flight, and there's a completely different body disposition when you talk about fight or flight. So even from starting in the mouth with digestion, there being 75% less less of the enzyme that digests carbohydrate, which is called salivary
Mm.
amylase. So even starting with that piece, you're going to have maldigestion of carbohydrate, and then
Mm.
that's going to go further down, partially digested, and cause some issues there. So, so one of the areas I look at is, I'll ask them to rank how stressed they are, 1 to 10, 10 being the highest, just to get a kind of a gauge of what their stress is like from day to day. And, if they're, eating in their car, if they're actually sitting down to have a meal, because all of that kind of plays into that picture of how well we actually digest carbohydrate.
Mhm.
In an optimal setting, we'd be sitting down at the table, we'd be
Mhm.
relaxed and able to disconnect. But nowadays I think it's becoming a lot harder to do that. There's less connection with food and less sitting down and eating and a lot of on the go stuff. And I think there's just an increased maldigestion of carbohydrate going on.
Mm.
And I think that may be why we have people starting to kind of get lower on things like inositol since it is
Mm.
from carbohydrate.
Mhm. So the idea is kind of that if you were producing less of this amylase, which you need to break down carbohydrate, you wouldn't be really digesting as efficiently those carbohydrate sources. So then you wouldn't be extracting all the nutrients from them, including inositol. Is that the pathway there?
That's my thought around it.
Okay.
A lot of this is still kind of unknown
Hmm.
as to why it works and why even with drugs, there's a lot of
Right.
unknowns with the mechanism. But I know that inositol plays such an important role in the cell in general, communication between cells, and also the ability to stay calm under stress. Yeah.
Hmm. So is there anything, really what do we know about how inositol works? And maybe we don't know everything yet, but how else is it used in the body?
So, um, so it does play a role on the membrane, like I was discussing,
Mm-hmm.
that it plays a role in communication between neurotransmitters, and something interesting that I found about it was that it tends to be low in the brains, or they tested the cerebral spinal fluid of depressed and bipolar patients and found that it tends to be lower in that population compared to normal. So we know that inositol tends to be lower in that population. So how that mechanism works is still kind of
Wow.
unknown, but lithium, for example, a lot of the theories on how it works actually revolve around inositol. So, because even though we don't really know the full mechanism, we
Hmm.
do know that there's some aspect of depletion that goes on that may be contributing to some of those mood shifts.
Are there so what conditions has inositol been shown to be especially promising for? So you mentioned anxiety. Are there others? Just kind of given that neurotransmitter connection, because that could influence
Yeah, so
so
there's
many different
some
concerns.
research on depression, panic disorder, OCD, even some binge
Right.
disorder and bulimia research. So with um,
Mm-hmm.
depression and anxiety, there's studies looking at using it as combined therapy or as separate therapy. So with depression, they did 6 grams of inositol, and it showed to improve the moods of about 9 out of 11 patients. So that was a pretty significant study, and that led to another study, a
Yeah.
double-blind controlled study, where it showed 12 grams given over 4 weeks improved depression. So, and there's also some promising research there with combined
Wow.
therapy with antidepressants as well as being a good adjunct type of approach. There's less research with bipolar disorder, but there is some promising studies looking at it with being combined with medicine.
Okay, got it. Got it.
Yeah, and then anxiety and panic disorder. The study that I saw on that one was a more significant study. They compared inositol to fluvoxamine, which is the kind of mainstream anti-anxiety medication, also used with panic and agoraphobia,
Mm.
or fear of crowds and large spaces. And they found that inositol was performed kind of at the same level as the actual drug. So I think that can be really promising for a lot of people that, because one of the problems with anxiety meds in general is that we have typically low compliance with that. Only about 50 to 60% of people stay on it, and a lot of that has to do with side effects.
Mm.
So side effects like nausea and GI dysfunction. And one of the things about inositol is that with how they've studied it, tends to be pretty low on producing side effects. So I think that's why I really like it as either an alternative if medication isn't working, or even a combined type of approach.
Mm-hmm. Mm-hmm. Wow. So, Ashley, you had mentioned a couple of minutes ago a case study. Can you tell us more?
Yeah.
I'm always interested to hear, more about, personal experience. And I mean, case studies are really just a great way to get a sense of what's worked for different people, right? So, yeah, what have you seen?
Yeah, so this particular study kind of is what got me interested and curious about inositol. I had a patient with several issues. And I have her permission to share it. She agreed to let me share it, but
Mm.
um, she had she had PCOS and history of that, and something called CIPD,
What is that?
which is a neurological condition similar to MS, multiple
Oh,
sclerosis, where
wow.
you have kind of a breakdown of the myelin on. trying to figure out how to explain that better. um,
Yeah. Is it kind of like the myelin sheaths?
yes, yes,
I kind of
yeah,
think
on the myelin sheath.
the way I sometimes describe those is that it's like the protective coating over our neurons, like over some of
Yeah,
the
that's a good
communication
example. Yeah.
pathways, right? So there's
So she
breakdown. Yeah.
So she also had some pain in her legs and
Hmm.
cellulitis from her knee down, so an inflammation of the skin, which cellulitis can be a pretty serious thing, and kind of hard to manage because once you have it once,
Hmm.
you tend to get it over and over, and you have to remain on antibiotics, and so there's just can be a very difficult thing to overcome. And then she also had something kind of interesting. So with the CIDP, she would also have her leg would basically go numb as she was driving. So she could only
Jeez.
drive no more than 5 minutes. So she had that going on. She couldn't write very well. So she sent me an email about a month ago just describing some of the changes that have happened throughout our treatment. And so one of the big things that happened is she was able to drive finally. So she was able to, after we did some intervention, she was able to drive for further distances.
Wow.
And she was also able to see a change in her handwriting over time. So before,
Hmm.
she couldn't even hold a pen very well. So she had kind of you could see a huge difference between her handwriting before and after treatment. And so I found that really interesting. So one of the things we did was we looked at micronutrients. We looked at her micronutrients to see if there's anything that was low. So we did a test and found that B12 was low, folate, zinc, inositol, B2, B5, and B6.
Whew.
And, one of the things that she mentioned kind of at the end was that she also had, a lot of racing thoughts, a lot of anxiety. But, that was on the end of the list because she had all these big things going on, like cellulitis and stuff like that.
Hmm.
Um, so we know with B12 that you can have when it's low, you can have it's commonly low in mood disorders. You can have peripheral neuropathy, like nerve damage. So I saw that kind of fit her picture pretty well. Um, and with zinc, since zinc makes your serotonin and dopamine and also plays a huge role in the immune system,
Hmm.
kind of saw that fitting with the cellulitis picture. And then a lot of the B vitamins and inositol really fitting the neurological side of that and the mood, racing thoughts, that kind of picture. So we started working on repleting those over time. So on supplementing for about 4 to 6 months, and she started kind of slowly noticing all these changes, like being able to drive further, her handwriting, being able to write again.
Wow.
And one of the things, she ran out of inositol one day and said, I have to go back on that because
Oh.
my husband's noticed that my mood's changed and I'm a lot calmer and able to handle stress better.
Hmm.
And so I was really curious about that because prior to working with her, I had only heard of inositol being used for blood sugar regulation and PCOS.
Mm-hmm.
And so I was kind of curious. Well, is there anything out there on it actually helping with mood support? And so that's kind of what got me curious about it because I see a lot of GI disorders, I also see anxiety, and so yeah, I was really fascinated to learn how inositol and even we're using a lot of different treatments here, but how inositol might be contributing to helping her kind of stay calm and be able to weather the storm better. And I think that's really valuable because if you're able to handle all of these things better with having less stress, then you're able to recover faster as well.
Mm-hmm.
And so I think that's really valuable. It's always really valuable to consider how the stress of something might be affecting them. So the stress of actually having it,
Mm-hmm.
but then, that puts a stress on your body. So coming up with ways to support the stress side is also, really important.
Yeah, I really like that you like walked through all the, the considerations that you did because what a beautiful example of a comprehensive integrative nutrition assessment and treatment approach, right? You're thinking about the roles of different nutrients, you're thinking about vulnerability to deficiencies, and then tracking symptoms along with really targeted interventions. And what incredible results. Who would have ever thought that handwriting, hello, handwriting could be
Right?
impacted by anything
Yeah,
that's something that a nutritionist or dietitian would do, right? So it's
exactly.
just like there's nothing
Yeah.
nutrition doesn't touch. Wow.
Yeah, and so this is an ongoing patient as well. So we're still working together. So cellulitis improved by about 80%,
Oh my
which was really
gosh.
huge. So we
Wow.
did some probiotic therapy there. We even did a vitamin D directly on the cellulitis to help. So we've seen some progress. It's not fully complete, but yeah, I think she is able to kind of move forward now because she's got this mood support in place. And I think that really intrigued me. And something that I started using more of is just really making sure that you support the person through the hard parts of all of it.
Mm-hmm. Mm-hmm. Yeah, through really a variety of interventions, it sounds like.
Right.
Yeah. So you and I have talked about how we've both played around a little bit with inositol. So do you want to share a little bit about your personal experience?
Yeah. So one of the other reasons that I was really curious about it is over the last year I've had a really stressful year. So I had
Mm.
um, kind of I had a year of really grief and high stress. I lost a family member.
Oh,
Kind of
geez.
went through that phase of dealing with that, and then I developed this thing in the spring where I had this bump appear on my leg, and it basically got some kind of either infection or autoimmune type of thing. I'm not really sure what it was exactly. One of the thoughts was that it could have been a bug bite, and just gone wrong, and spreading throughout. There had a lot of unknowns there, and a lot of stress, and
Jeez.
kind of throughout all that, it certainly increased my own anxiety and increased panic attacks and that kind of thing. So it was actually I learned a lot from my patients, and so I was really grateful to learn a little bit about different ways to even handle my own anxiety.
Mm.
So one of the things that I did for myself is that I first I focused on treating my own deficiencies. So I run the micronutrient test yearly on myself. I also use something called saffron.
Mm.
So saffron's a really beautiful herb that can help a lot with hormonal support, but also with anxiety, depression. And, my goal was not really to get rid of the grieving process by any means, because some of that I think is a normal course. I think we're
Mm.
supposed to feel the loss and feel the
Mm.
pain and go through the pain of, instead of, stuffing it down. So my goal was really to support my body through it. So I used a little bit of that. I used some probiotics, and then I also, when I found out about inositol, I started using a fairly high dose of that, about 12 grams, which is
Mm.
typically what is evidenced for anxiety and panic disorder. And I noticed a significant shift. So it was very subtle. It wasn't like night and day by any means, but I noticed over the course of the next month or two that I had no panic episodes. I was feeling calm in situations that I would normally feel anxious, like airports would typically make me feel anxious with all the people and kind of chaos, and you're rushed to get to the next thing. So I noticed I was in the airport and I was totally calm. Also with presentations and, public speaking, I noticed that I was able to get through that. And I kind of, at the last presentation gave a month or two ago, I was sitting there before thinking, gosh, I feel like I should be anxious right now. Something's wrong. and and so yeah, I noticed. I was like, I wonder if that is, some of the effect of
Hmm.
inositol doing its job. So yeah, I kind of noticed over time that I went from, having these panic episodes or feeling of high stress to just slowly being less over time and completely gone at this point. And so that was a really big transformation for me to see just to kind of put all this to work, my life's work, put it in to work in my own life,
Yeah.
and to
Yeah.
see how powerful and be reminded of how powerful it is.
Hmm. Yeah. Wow. That's really, really incredible that, you kind of have had really just your own comparisons in, similar situations, like an airport, for instance, and you've noticed, something that people will sometimes say to me is that they feel like their anxiety or their, just their overall predisposition to be a little bit on edge gives them an edge in life
Mm.
or in work and business, whatever it might be. And I'm curious to hear your thoughts on this because I personally, as I have been, playing around with just things myself, have come to a kind of a different place. I think I used to think that a bit. And I've kind of started to realize for myself that actually, if you are in a place where your, central nervous system is well nourished and you have a sense of calm, it does not mean that you're any less motivated or driven or focused, and that in fact, if your body isn't in panic mode, if you do have kind of that internal locus of control, if you're able to self-regulate really successfully, it allows your brain to work even a bit better. Like your thoughts can be clearer, you can think more quickly, right? This idea of neurotransmitter communication, be more effective in your relationships and networking, etc. So I don't know. I felt like I should mention that here because it's not just I don't think about going from feeling anxious or feeling on edge to just being in a zen state all the time. Like that's not been my experience, but rather it's feeling like there's something going on in your body that you're not really in control of, like kind of the sensation
Mm.
that's
Hmm.
uncomfortable, to feeling like you're okay in your own body and you're able to kind of self-regulate in the midst of whatever it is that you're struggling with. So that's a little bit kind of outside the realm of nutrition, but just to kind of speak to personal experience and kind of just, yeah, working through different ways of being, right? And figuring out, all right, so what's even your goal
Right.
for a nutrient intervention? What are you going
Yeah.
for, right? So, yeah.
Yeah. Yeah. And I kind of feel like I've learned to be thankful for that disposition,
Yeah.
and really move past the shame of,
Yes.
having something like that. But I've learned to be thankful because, that same trait that can lead me to overwhelm, it also allows me to be really cautious, to
Yes.
be intuitive,
Mm.
to be very sensitive to my environment, to be totally present when I'm with a patient, and really to be thorough. I think people with anxiety tend to be a bit more thorough than the average. They might be a little bit more, um, put a little bit more. I'm not sure what I'm trying to say there.
Yeah, like
They're more thorough.
detail oriented. I mean, you are incredibly
Yeah.
detail oriented. Yeah, so that's something. Yeah. Yeah. Wow, this is really such a great conversation. So, yeah, let's just kind of think through this and try to summarize a little bit here. So we've talked, my gosh, we've talked about, all right, so what is anxiety? How might you approach it as a registered dietitian? What are some tools you found that help? Talked about inositol, really specifically some of the mechanisms and, why a supplement versus just in food. That really incredible case study, a little bit of the research. So, when you reflect back on this conversation, what do you think are the, gosh, I don't know, five take home points? The things that you really want people to walk away from this, remembering and being able to take action on?
Yeah, I think the biggest thing is being curious. So being curious and thankful, like we were saying, about our own anxiety, and trying to understand it, because I think our anxiety is there to kind of clue us in on
Mm,
either one, something we should change, or two, something we should be aware of. So I think that is the biggest thing, is to be curious about it. Two, it could be that you need to looking at more of the root issues that could be driving kind of that dysfunction of anxiety. So the
mm,
common ones would be lifestyle, would be the obvious, but also deficiency, immune dysfunction, gut dysfunction, looking at
mm,
those pieces of the puzzle as well, maybe with a provider, healthcare provider. And, you know, three, I'd say if meds aren't working, looking at some other options that can go alongside meds or taken instead of meds, because I know we do know that some people just at a genetic level tolerate meds better than others. So if you're someone who hasn't had a good experience, looking at other options to help support you through that.
mhm,
And then
mhm,
also, consider looking at deficiencies, looking at and maybe even considering inositol as a starting point for there's definitely some good evidence around it. It might be worth it to try that out. And really, if I could leave with anything, it would be to really reframe anxiety and or any health challenge that you're having. Really, I know there's a lot of messaging around healthcare. Around we typically use terms like fighting, fighting this or fighting that.
mm,
But really, what I think is that your body is not out to get you. It's designed to heal, and it's always been working for us. So our bodies are meant to work in that way. Um, so that mindset shift can really change the way that we approach treatment, when you change it to think that it's not about stopping or controlling the body, but really about listening to it and being curious.
mhm. Yeah, and really just it sounds like being open to all of the tools that are available, right? To
Right, right,
better support ourselves physically, mentally, and man, nutrition, nutraceuticals, supplements, right? Food based interventions, dietary interventions, foundational.
right.
Yeah. Wow, this has been awesome. Ashley, thank you. Thank you, thank you,
Thank
thank
you.
you for all that great detail and background and for sharing a little bit about your own personal story. I'm trusting that, those who are listening have, really taken some things away from this. If people are looking to connect with you or just want to kind of learn more about your approach and your work, where should they go?
So I do a lot of my posting on Instagram. So
Mm,
my handle is Ashley Hurst RD. And then you can also look at my website. It's wellnessbydesignonline.com.
okay, beautiful. Yeah, beautiful. So Instagram and a website there. So, Ashley, as we wrap up, I just want to again say thank you. And to those who are listening, want to get in touch with Ashley, learn more about Inositol functional nutrition approach, please get in contact with her to learn more about how she could support you. So, Ashley, have a great rest of your day. Really, really appreciate you.
Thank you, Sarah.
Sarah here, owner of Mindfully Nourished Solutions. It's my goal with this podcast to explore strategies for empowered and well-informed food and eating decisions. If this information has been supportive to you, please head over to iTunes to rate this episode and to leave a review about what was most helpful. To learn more about how food is impacting the way you feel on a day-to-day basis, head over to my website at mindfullynourishedSolutions.com for a copy of my free food mood journal. See you next time.